It is the platform, the pinnacle of all discussions right here on Flow 94.9 FM, the first edition for the week. My name is Chioma Nkwanta and a very good morning to you. As widely speculated and projected, the second wave of coronavirus is upon us. Over 400 new infections were recorded last night across 19 states of the Federation. And since the beginning of September to the end of November 2020, Nigeria has recorded a gradual increase in the number of confirmed COVID-19 cases in the country. However, last week, surveillance actually recorded a sharp increase in the cases. The average number of daily cases recorded in the last week was higher than was recorded between September and November. Still, just last week, a major general died of COVID-19 and about 28 army officers who had contact with him have all tested positive to the virus. Now, this leaves Nigeria at the verge of another possible lockdown, as the public have thrown caution to the wind. The guidelines have been abused. The COVID-19 guidelines have all been abused, and life seems to have gone back to normal, even while the dreaded vista is still in town. The ray of hope actually is that there is a vaccine, but we still need to be careful, very, very careful. Again, a very good morning to you and welcome to the platform for this week, the pinnacle of all discussions. And today we'll be looking at the second wave of COVID-19 and also the Abia Tele-Health initiative to ascertain its effectiveness in aiding accessibility to healthcare. My guest is the project coordinator, Abia Tele-Health initiative, Dr. Obiame Omas. A very good morning to you and thank you for joining us this morning.
Good morning. Thank you for having me.
All right. So first of all, let's look at the way we Nigerians actually threw caution to the wind and we've been living our lives like COVID never existed in the first place.
Yes, I think I agree with you on that. I think mostly a whole lot of us got carried away by the overall reduced effect and impact that we witnessed on this part of the world, attributable to so many things from our temperature and our already pre-exposed exposure to cold viruses. So yes, I think we did throw caution to the wind, but over and above that, I think Nigerians had bigger fishes to fry too. So we sort of reprioritized our problems and placed COVID below on our list.
Okay, and now look at where that has gotten us. Now, looking at the update from the NCDC recently, that was yesterday's update actually. It was provided that 418 new cases of COVID-19 have been recorded in Nigeria. Lagos State with 113, the FCT with 86, Abia State with 47, Kaduna State with 39, Rivers 27, Katsina 22, Benue State recorded 14, Oyo State 13, Kano 12, Enugu 8, Edo 7, Imo 7, Bauchi 6, Ebonyi and Ogun States actually recorded 6 cases as well, but Ondo and Nasarawa states recorded 4 and 1 each. Now, in total, we have 73,175 confirmed cases of coronavirus, with 66,090 discharged, while 1,197 have died so far. Now, this is coming from the Nigeria Center for Disease Control and CDC. Looking at the spike, the recent spike in COVID-19, the coronavirus cases in the country, where did we get it wrong? Because from previous results, we realized that the cases had reduced. Now there is a spike. Where did we get it wrong?
And even with the total numbers you called, I think it's still a tip of the iceberg because Nigeria is not testing relative to the rest of the world.
Okay.
So in all of this, we've tested about 848,194, and this is less than 0.5% of our population. So we're not testing. Fortunately for those of us here in Abia is one of the states that is still testing. A lot of states are shut down. Isolation centers are closed. So I think it still goes back to my previous assertion that we took for granted the reduction in the impact that we were experiencing, and then we reprioritized. We had other problems we needed to focus on. So that took our eyes off the ball. So I think if we are testing more, we will probably get many more cases.
Okay, Abia State actually recorded 47 as at yesterday.
Yes.
That's quite a number.
With about 17 positive cases in the hospital. So yes,
okay,
there is a spike. There's need for us to reprioritize, to put COVID back on the table and start the discussions, start reintegrating ourselves back to the COVID protocols. Masking up, washing our hands, social distancing. So we need to go back to what we did before when we started noticing the downtick. Especially now, this period of the season, it's Christmas, there's elections in some states. So we need to start telling ourselves that COVID protocols needs to be integrated into these exercises. There's going to be a lot of travel, international, local, community spread.
Okay, all right. Now, Abia State recording 47, and the Telehealth initiative. How will that benefit us?
The Telehealth initiative, proactively, or like I say, clairvoyantly, Telehealth initiative. Abia State Telehealth initiative was the first state-owned telehealth intervention that was set up way before COVID. It was almost like His Excellency saw COVID coming and was prepared for it. So we were the center response call center during the COVID. Over and above access, escalating of cases, we had our own protocol. So our protocol involved, when you call, we were the response center for the state. So when you call, we're able to sectionize our calls into suspected cases and then non-suspicious cases. So the non-suspicious cases were able to treat as much as we could over the phone, especially recognizing the fact that people were asked to stay home. So sickness is not geographically bound, so whether you are home or not, you could fall ill. So Abia was ready to provide some sort of virtual platform that normalized the clinical system in the state. And our response was also tailored to home-based care because we were cognizant of the fact that people couldn't leave their home. So if you called and you said you had a cold, and we're able to clerk you to the extent that we thought it wasn't COVID-related, we'll ask you about, do you have lemons in the house? Do you have honey?
All of this clerking on the phone?
On the phone, absolutely. And if it was COVID suspicious case, we escalated immediately to the state interministerial COVID response team. They had their own protocol of response. If it was emergency case, we escalated to the emergency response team. So we had our own protocol, which with the governor's mandate yesterday, we have reinstitutionalized again today to go back to our COVID response protocol.
Okay, so basically the telehealth initiative is just for you to place a call to the center and you'll get a quick response immediately.
Yes, clinical or otherwise.
Okay.
We also provided a lot of mental support because some of the cases too were anxious cases, people who just needed their fears allayed. So we talked them through the process, reassured them, counseled them if they needed to go and test. There was, reassured them that there was no problem with being COVID positive. The state was ready to treat you for free and nurse you back to health. So we had all of that.
So what about those in the hinterlands that can't get through, probably network issues or something?
We're trying to work with Globacom on that. There's a lot of network upgrade going on now. There are 3 masts being set up in Abia State, 1 per senatorial district. So we're working with Globacom. The governor is very keen on not trying to institutionalize telehealth on the backbone of medical tourism. And then because he's the poster governor for Made in Nigeria, he was very keen on Globacom.
Okay.
So Globacom is doing a lot of work around the state to improve their network to reach those in the hinterland. Yes.
Okay, so they will not be left out of this initiative.
That's part of the plan. The biggest objective of telehealth is to drive healthcare beyond those, for those who cannot physically access it for whatever reason, financial, geographical, lack of infrastructure, but they have a phone.
Okay.
And then when people know better, they generally will do better. So if they have a conduit through which the right, reliable, timely information can be conveyed to them, it's a way of universalization of healthcare per se, leveraging on telecom.
Okay. So though we're talking about coronavirus and the spike in recently, is it just coronavirus related issues that people call in to complain about, or we can call in for everything?
You can call in for everything, mostly healthcare.
Okay.
So clinical or otherwise.
Whatever case.
Absolutely. It's a clinical call center.
A clinical call center.
Yes, where we provide supervisory support to both individuals and institutions, especially institutions not medical doctor manned. So yes, you can call in. We're currently linked to Abia State's 772 primary healthcare centers. So we also help to guide them. So for instance, you go to the primary healthcare center with a symptom that the nurse on duty do not really know how to handle. She could call our call center and we would walk her through it to the best of our ability. Sometimes when you call to, the most important information the doctor could give to you would be to refer you, to say, what you have is not what you think it is. Please go to the nearest hospital. So yeah, it could go both ways.
All right, still on the telehealth issue.
Yes, ma'am.
Those that man the phone lines, that answer the calls and every other thing, are they trained medical personnel?
Absolutely. Qualified medical doctors. All our call center agents are medical doctors.
Okay. So I'm not just talking to a customer care?
Not at all. We don't do customer care.
Okay.
We do clinical care.
Okay, clinical care.
Yes, ma'am.
Yes, it is the platform in Flow 94.9 FM, the pinnacle of all discussions. This morning, we're looking at accessibility to healthcare. We're looking at the spike in COVID-19 cases in the country. And I have with me Dr. Obiame Omas, who is the project consultant, Abia Tele-Health Initiative, and she's doing justice to the topic this morning. Now there is a vaccine concerning COVID-19. We have a vaccine, and we hear, according to reports, that soon Nigeria will be getting a part or a dose of this vaccine. First of all, how does this vaccine work?
Okay, so the vaccine, like the new COVID virus, comes with a lot of controversy, which, like everything new, is expected. What people do not understand, they would naturally question. So questioning it is actually smart and the expected way to go. So how does it work? Like a lot other vaccines, really, the protocol is not different. It's what clinicians call an RNA virus vaccine. So it's supposed to, again, like every other vaccine, stimulate a response in you such that your body now produces its own natural immunity. So the vaccine, it's like a stimulator.
Okay.
It's introduced into the human body and it quickly disintegrates just after stimulating your body to provide or start to develop that natural response by itself.
Okay.
For now, it's been said to be 95% efficacious, which is really, really good for a new vaccine. And if you consider the trend, yes, there's been some side effects. It's gone through the normal trial phases. A lot of people have been saying that it's been rushed, so maybe some phases have been skipped. But that's not the truth, because I also was part of a webinar series that was anchored by one of the illustrious Abia sons, who is a Yale doctor who was involved in this vaccine production, Dr. Onyema Ogbuagu, where he threw a lot of light on the topic. So the vaccine has gone through the normal 3 phases, trial phases, like every other vaccines. The side effects, though mostly short-term for now, is also normal. People react differently to a new thing being introduced to their body. So like every other vaccine, this vaccine has shown short-term side effects. There's not much known about the long-term side effects yet. Of course, because there's no long-term data on it. So as new as the virus is, so also is the vaccine new. So also is the data being gathered, evidence on the vaccine and the virus. So a lot of things are happening at the same time. But I think that the vaccine is the best way to go, because the virus obviously is much more dangerous and much more unpredictable. The vaccine for now shows a predictable pattern. So I, for one, will be taking it. And I think, so there's a high power delegation now for, I think, the distribution or the dissemination or the entry of the vaccine into Africa. And again, Abia has shown, because Dr. Ngozi Okonjo-Iweala is on the team for Nigeria, I think. She's also an illustrious daughter of Abia. So I think that's like a double tick.
Yeah. Okay, so there is hope for us. We'll take a breather on the platform, and when we return, more on the coronavirus vaccine and the recent spike. Don't go anywhere.
94.9 FM. We've got conducive and well-secured environment for business. High-tech video studio, a state-of-the-art production studio. You can also listen live on www.flow949fm.com and watch our videos on YouTube at Flow FM TV. Flow 94.9 FM, not just radio, but a complete broadcasting house.
Well, glad to know you're still there. This is the platform on Flow 94.9 FM, the pinnacle of all discussions. This morning, the first edition of the week, we're looking at the second wave of COVID-19 in Nigeria and the Abia Tele-Health initiative. And I have with me this morning Dr. Ubiame Omas. She is actually the project consultant, Abia Tele-Health initiative. Thank you again for being a part of this program.
Thank you again for having me.
So before we went on that breather, we're talking about the COVID-19 vaccine and how it works and all of that. The vaccine, is it just for COVID-19 or it could work for other diseases as well?
I think for now it's just for COVID-19.
Okay.
Unless otherwise stated. But for now it's for COVID-19.
It's just for COVID-19?
Yes, ma'am.
Okay. Now, when we take this vaccine, is it that we become immune for life, or it's just it has a duration, it will elapse and then we go back to taking it again? For instance, like the chicken pox and all those things that we take, and we just take it once in our lifetime. The vaccine, is it like that?
I don't think that has been ascertained. So that's those are part of the discussions on the table, and those will be evidence driven. And like I said, because it's new and the vaccine is new, the data too is being newly collected. So the length of immunity is not yet known, just like the long-term or even mid-term side effects are not yet known. So as they keep testing, I think the vaccine has been given to over 40,000 people. So over time, all of that will begin to manifest, yes.
Okay. But looking at the vaccine and those that have collected the vaccine, actually, any side effects, any complaints, anything we should be worried about?
Yes, there has been side effects, minimal side effects for now. And then, like I said, because of the timeline, it's still what would fall under short-term side effects. And there have also been speculations that those people who have suffered side effects would have likely suffered side effects with other vaccines.
Okay.
Of course, for everything new, there will be issues to resolve. There are things to worry about, but it's still the same way we rationalize or make logical decisions. It's risk over benefit. Personally, again, for me, if the risk for COVID is higher than the risk for the vaccine, I think that answers itself.
All right. If the risk for COVID is higher than the risk for the vaccine, then you know which one to pick. Flow 94.9 FM, the platform this morning, Dr. Ubiame Omas, doing justice to the second wave of COVID-19, which is our topic, and the Abia Tele-Health initiative. Now we're heading back to the spike recently. Now that there is a spike, there is also the instruction to open isolation centers. In the first place, why were these isolation centers closed?
I can only speculate to that. Maybe for various reasons. The cost of running it, number one. Number two, again, we started noticing a downward trend. So maybe that was part of the protocol at the presidential task force level. Because if you notice, they started to relax a lot of things that were already put in place. So it went from lockdown to curfews. Even the curfews started to shut in, and eventually they were removed. So it was probably part of their review protocol for when the trend is reducing or appears to be reducing.
Okay.
Like I said, there could have been other reasons, which is again the cost. And then when there was already community spread, it made a lot of sense, even economic sense, for you to start to introduce home-based care, because it would be really, really, really expensive at that level to isolate everybody, and maybe for some it might even be seen as maybe counterproductive to put so many people in the same place while you're trying to physically distance them. So I think that was part of the protocol for when the trend started reducing.
So now there is a call to reopen all of them.
Yes.
Because of the spike.
Yes, because we're going back to where we started from when we started noticing the increase in spike. So we're tending to take it, again, it's evidence-based practice. You go back to those protocols that led to a reduction in the spike to see whether that would work again.
Okay. Now we know that Nigerians, a lot of us actually threw caution to the wind. We went back to our daily lives, we threw away our face masks. Some people don't even have face masks anymore. And now we're hearing that there is a spike. But some people still say, yes, there is a spike, but why don't I know someone that has gotten coronavirus? Or why show me one person has gotten coronavirus? There are a lot of people who still have this mindset.
With respect, His Excellency Governor of Abia State, Dr. Okezie Victor Ikpeazu, caught the disease. So if for nothing else, it means that anybody can have it.
Okay.
So for those people who are looking for not knowing, I know a lot of people that have tested positive. I know close relatives. I have lost friends. I have lost colleagues from it. So because you don't know doesn't necessarily mean that you should undermine it, I think you're still safer practicing the protocols. I'm opposed to waiting to know someone, or even you being the person you introduce yourself to COVID. Well, I think it's a step in the right direction. We need to start, and we really threw caution to the wind. We started socializing again, burials, parties, churches, crusades. There was Shiloh last week, so we're going to see all of that effect very soon, because it still remains that a significant amount of people are asymptomatic but still transmitting the virus, you see. So that's the risk. So masking up really is, as much as protecting yourself, it's more of you protecting the other person, just in case you are an asymptomatic carrier.
Okay. All right. In case you are asymptomatic, just be careful. Okay. The pinnacle of all discussions, Abia Tele-Health. Is there a number that we can call, to reach you, for those of us that don't know this number?
Yes, please. So our number remains 0700 Abia Doc, which is 0700 2242 362. Again, it is 0700 Abia Doc, which translates to 0700 2242 362.
Is it toll free?
It's not, but there is a growing sub-network, that is the Abia Glow Telehealth network, that's already subscribed Glow customers can come in for 500 naira, and they have unlimited
access
talk time.
Okay.
They also have 100 free SMS monthly. They have 150 megabytes monthly data. So all of that was put together again to reduce the toll on those calls, because naturally when you call a doctor, it usually is a lengthy call. So that's part of the arrangement with Globacom on ground.
Okay.
So that it's not necessarily toll free, but it is hugely super saver deal.
Okay.
Because every person in that network, in that sub network, benefits from those privileges. So it's not just you calling the call center and having unlimited talk time. It is that if two of us are in that sub network, we can also talk unlimitedly.
Okay.
Per month.
All right. Okay, we'll open the phone lines now. I'm sure you've got questions, you've got contributions on the program this morning. We're looking at the second wave of COVID-19 in Nigeria. We're also looking at the Abia Tele-Health initiative. And I have with me Dr. Ubiame Omas doing justice to this particular topic this morning. So call us up on 0808 1826 949 or 0811 6052 949. We hear the likes of the Lagos State Governor testing positive and going into isolation. We also hear that Kaduna State Governor also has gone into isolation. This is among the spike, actually. Hello, good morning.
Hello, good morning.
Good morning to you. What's your name?
Ikechukwu.
Ikechukwu.
Calling from Omaya.
Ikechukwu, you're welcome.
What I want to say for this COVID now, they have only one center, Omaya. What if anybody who shows these symptoms far away from Omaya, one Omaya, one Naba?
He said something about having only one isolation center in Umahia, in Abia State, which is in Umahia.
I think isolation center.
Although the call got disconnected. Yes. Okay. So.
And there's two in Umahia. So there's FMC and there's the new one that Abians built.
Okay. All right.
Professionals in Abians.
So
I need to find that out.
Okay. The Lagos State Governor's aide actually tested positive for coronavirus, so the Lagos State Governor had to go into self-isolation because his aide tested positive to the virus. These are some of the things that we've been seeing lately. Hi, good morning.
Hello, good morning. It's Ikechukwu. I want to complete my distance.
All right.
This isolation center now, considering the population we have, on my and the health system, do you think that if there's a kind of a surge, outbreak surge, the number of patients, can you, the health center manage and handle it? How many hospital beds you have and the ventilators, the way you have? Can they manage it?
Okay.
The answer is no. The answer is no, because it's still limited. Because that amount is very small. SMEs you are talking now, it's someone of cubicles. Go there and look at it. It's really, when I went there, I saw it. It's very limited. It's not even a hall. It's a kind of a 1 to 2 rooms like that. The fence and painted or whatever like that. So if the government should come up with many hospital beds and they will too, more especially now we are having vaccine. We don't wait for federal government. State government can go and negotiate for this vaccine. Should we have Ministry of Health? They can go and negotiate and pay for this vaccine and come and start vaccinating their people. Like we eliminate from Lagos State. Lagos State will go up and do without waiting federal government to waiting for anything. Come and give us this thing. All this thing. You know what I'm saying?
All right. Thank you.
Fine.
Okay. You have a reaction to that?
Oh yes, I do. Thank you so much, sir, for your question. And yes, you're right. Most times the isolation centers, we at Abia Tele-Health, we usually just escalate to the interministerial COVID response team. They have their own protocol, but not every COVID person will be taken to the isolation center. That's not even feasible. You need to build a community to cater to that. So they have a protocol, they have questions they would ask. They have so if you can self-isolate, that's where the home-based care comes in. If you naturally can self-isolate, you'll be taught or you'll be put through on how to self-isolate and what you need to do. The isolation center and ventilators most times, especially with the ventilators, is for really sick persons. So those people for whom COVID has compromised maybe their breathing usually. Those are the emergency cases that will be placed on ventilators. So there are different definitions for different cases as regards COVID confirmed cases with the people who manage them.
Okay. So what are the benefits actually? He made mention of the vaccine. He You said something about going to liaise with the World Bank to get the vaccine. That's what our last caller said, instead of waiting for the government. What's your take on that?
I think the government is already doing that. Just the way the government went out of its NCDC protocols to get test centers and test machines on ground. So I think that the Abia State government is already doing that. But there needs to be some sort of synergy. I think it needs to work in synergy with the state's CDC needs to work with the NCDC. I think the vaccines usually will come into the country through the federal route, and there might be, again, protocol raised. Like abroad, it is you start with vulnerable, and then so there will be protocol for people on how to access it. I think, because I doubt that the vaccine will just be readily available for everybody. It might be in stages. So all of that will become clearer as I think in the next couple of weeks. Okay.
So we haven't established the benefits of getting the coronavirus vaccine, actually. So what are the benefits?
So for now, like I said, it's 95% efficacious, which is huge for a new vaccine. So that in itself is validating that you should get it. But more importantly, there's also been the case of whether people who have been exposed and recovered have had some sort of immunity. So the science says that they have, but the vaccine confers longer and better immunity. So this means that whether you are symptomatic or asymptomatic, whether you have been treated and recovered, the vaccine still remains most efficacious for now with all of those variations, as it were.
Okay. All right.
There's also the cases of pregnant women, whether pregnant women should have it. Again, from that session with Dr. Obuagu, a couple of women who didn't know they were pregnant got the vaccine, even if it wasn't supposed to be a pregnant women were not meant to be exposed to the vaccine for various reasons. They haven't showed any side effects and they're still being monitored, but I think currently it was safe for them for now.
Okay, all right. Yes, you can contribute or ask questions on 0808 1826 949 or 0811 6052 949. Good morning to you.
Good morning, people.
Good morning.
Good morning, my ambulance sister in the studio. Good morning, madam.
Good morning, sir.
Yes, I remember Mr. Prince Oshuagu from here. No more natural.
You're welcome.
My sister, I'm very, very grateful on the work you are doing in that studio.
Thank you,
sir. You are sensitizing those that don't know actually what that's the effect of this COVID-19.
Thank you, sir.
God bless you, my sister.
Amen.
Amen, and you too, sir.
I hope you are an NGO. Are you?
You're an NGO?
No, we're Abia Tele-Health initiative. We're governmental, sir.
That is you are governmental organization, not non-governmental organization, right?
Yes, we're governmental organization. We are the Abia State Telehealth initiative. So it's a telehealth program. It's an organization that is leveraging on telecom to drive healthcare.
I love your complementary role in this fight against COVID-19.
Thank you so
much.
My
advice go to the federal government and the state, most of the state government. I believe the bulk of your job fell on the area and on the national and state orientation agency, and equally the Ministry of Information. I believe this is time for them to ensure that everybody is being sensitized on this particular matter. Let them not go and sit down and leave the entire job for you people. Let them help you people. Then finally, on the governmental issues, I believe many states, most of the advanced states like the United States of America and the UK, they have now incorporated themselves into the use of this vaccine called Pfizer vaccines. I believe the Nigerian government should link now before it is too late, because I know the wave how this COVID-19 is coming so high. Let the federal government and state government, let them join hands to ensure that our populace are being vaccinated with this particular Pfizer vaccine. And my happiness is that this vaccine is originated from one of our brothers, an Abia man, Obuagu. So let's all join the issues to ensure that we fight against it.
All right.
That's my team. May God bless you.
You too.
Thank you so much, sir.
Okay, so we've got a message on Facebook, one from Omaga Namani. He's actually watching us live, and he says he's watching from Amagunze in Enugu State. He says tackling COVID-19 pandemic requires a holistic approach, and more so, Nigerians need to imbibe most of the established protocols by the NCDC. All right. Good morning.
Hello.
Hello. Please turn down the volume on your radio. Thank you.
Okay, yeah, done that. My name is Chima.
All right. You're welcome.
Hello?
You're welcome.
Yeah, thank you. Thank you. You see, you know why the reaction and the response from the Nigerian populace or the people to this COVID-19 is because they don't have any confidence, does not trust the government, even though that is not sufficient reason for the people not to, adhere strictly to self-protection by, wearing the mask and then observing all those protocols. Now, that is number one. I personally, I don't take it for a joke.
Okay.
That's an issue. At this very point in time, people look at me. In fact, I have become a laughing stock. I don't care. I don't look at anybody because I know what is happening all over the world, in Europe and the USA. My bosom friend in the US is, in the service of, taking care of the elderly in the Texas. Honestly, called and said, I thank God for him because he resurrected from, let me use that very well, from death. He had it, and he was in the intensive care unit for one good month because there was no communication. We used to communicate weekly, and he told me he had it. And then a number of elderly people are dying, even in the where he works. So I see the US, I see everywhere, and Nigeria. But because they don't have any confidence, and not until Nigerians or not until it happens to somebody close to them. I went to church, and I'm sorry I belong to Living Faith. I'm sorry I'm not trying to judge them, but I do what the government says. And then you have to obey the government and obey God.
All right.
Now I went to church. Yes, it's like I'm the only one. They announced it, and all of after a while, people stopped. So even during this show, I was wearing this thing all over. As I'm driving, is in my car. I have about 5 of them. I changed.
All right.
So I don't know why. Like somebody said lastly, a national orientation should come into the interior, go to the market, go to Nkwanta, go to Akara, come to Zakole, come to the market, go to places, even the vehicle. And I used to come to SMC. The doctors, some of them don't wear. The nurses, some of them don't wear. So what message are they giving out? Giving out to the people when these people don't do it. But by the grace of God, I do it. I'm not boasting. I know that God is in total control. Thank you very much.
Thank you very much.
My sister, the consultant there,
Yes,
you are a very brilliant woman. Thank you, and may God bless.
Thank you so much, sir. Thank you, sir.
Okay. We also have one from Nemeka KC Major. It says, is the vaccine created by Nigeria or imported, please?
It's created by Pfizer. It's being imported into Nigeria.
It's being imported into Nigeria. It's not created by Nigeria. Yes. Okay. I would need for you, Doc, to actually take us through the whole COVID-19 protocols and what we're supposed to do. Looks like we've forgotten.
Okay, so the protocol still remains. There's an acronym for the ones you're not supposed to do, which is the MEN.
Yeah.
So do not touch your mouth. Do not try as much as possible. If you have to, please remember to wash your hands. Do not touch your nose, do not touch your ears. These are because these are mucous membrane lined parts of your body, and they can easily transmit the virus when they are wet and mucus lined. So stay away from knowingly touching your mouth, your ears, and your nose. So the ones you should do should be: wash your hands regularly, wear your face mask, physical distancing. So there's a bit of controversy about whether it is social or physical distancing. There's so much to socialization that is not physical. So it is physical distancing, keeping 1.8 meters, which is about 6 feet from each other. I think it's your basic hygiene and sanitation. Do not hold on to raise. So these public places or public shared facilities or infrastructures, as it were. So you want to look at something as minimal or as minute as POS machines, if you can, ATM machines, lift buttons. These are high risk transmission surfaces, as it were. Sanitize your hands. So even if you don't have access to flowing water and soap for 25 seconds, just go about with your pocket-sized sanitizer. Just try and be conscious of it. If you want to shake somebody, remind yourself to retract and just, they call it air shake or air hug. Yes, or even the elbow too is contact. Well, air hug or air shake. So we need to start reinstitutionalizing those things that we did a couple of months back. We need to start reminding ourselves, like we said, the season. It's Christmas. It's Harmattan. There's elections. There's going to be a lot of celebrations, but we need to be responsible for not just ourselves, but for others too. And these protocols save lives. It's important that we consciously remind ourselves when we are only as essential errands. If you don't have to be out, stay indoors. Hopefully all of those will begin to reflect, and then with testing, I'm sure even the testings will pick up now. There may be no need for more drastic measures like lockdown, hopefully, if we're able to imbibe these basic protocols. Yes.
Okay. All right. Thank you so much for being a part of the program. But before I let you go, the telehealth number, Abia Tele-Health number again.
So the telehealth number again is 0700 Abia Doc. So which translates on your phone to 0700 2242 362. Again is 0700 2242 362.
Okay. All right, it is the platform, the pinnacle of all discussions, and we've come to the end of today's discussion on the platform. On Wednesday will be another edition of the show. My name is Chioma Nkwanta. Special thanks to our producer, Samson Eze, and also thanks to Dr. Ubiame Omas, who is the project consultant, Abia Tele-Health Initiative. Thank you for being a part of the program. Enjoy the rest of your day.
Thank you for having me.